Greetings. My name is Kayla Billups, and I am a representative of the group Women to Women that studies the relationship of maternal health and postpartum depression susceptibility among minority ethnic groups. Our study focuses on researching postpartum depression before and after pregnancy. Postpartum depression is a condition that affects many women every year, and as there are several self-screening surveys that are available to women that may be experiencing postpartum depression, there is a large racial disparity when it comes to the susceptibility of postpartum depression. African American and Hispanic women are almost twice as likely to suffer from postpartum depression than white women. Thus, our group and other researchers must study this topic because it reflects the lack of health equity in the United States. Our survey was a cross-sectional analysis focusing on ethnic identity and mental health. Our research pool was women, focusing mostly on their background and mental health history. We utilized the Edinburgh Postnatal Depression Scale to detect postpartum-related symptoms, along with other socioeconomic factors that contribute to developing symptoms such as education, employment, annual income, eating habits, and task difficulties. Our cross-sectional survey was conducted through Question Pro and consisted of 33 questions that were sent out to female participants via Teams and text message. The survey was open for 14 days. Based on our results, the mean age of female participants that took part in our survey was between the ages of 18 and 24. As seen in this graph, most participants identified to be from a various ethnic groups, with most participants identifying as being either Black or Hispanic. As seen in this graph, most participants that identified to experience sadness and gloom were from the Black and Hispanic participants. Running an ANOVA test on our data, we learned that there was not a significant difference between ethnic background and postpartum depression. A limitation to our study was associated with the surveys being from a homogeneous group, meaning that most to all participants were between the ages of 18 and 24, lacked insurance, and only 4 participants had children. Another limitation to our study correlates to the specificity of the survey. Survey questions were not specified to be related to mental health issues prior to COVID-19. Thus, participants may have entered mental health information that is influenced by the pandemic. However, a major strength of our study is associated with most participants being college students. This allowed more data collection of mental health issues related to pregnancy from this age group. However, it is recommended that future studies submit surveys to more sources such as UTA's Women's Health Clinic, the Psychology Department of UTA, and other neighboring colleges. Thank you.